If your kidney function is slowly going down, especially if you have type 2 diabetes, I want you to stop and listen carefully, because the mistake that damages many kidneys is not always the medicine someone forgot to take. Sometimes it is the food they were told was harmless, the breakfast that looks normal, the rice that feels traditional, the bread that says whole grain, the juice that looks healthy, the cereal that says heart-friendly, the low-fat snack that still turns into sugar inside the blood. And while the person keeps eating these foods every day, the kidney number slowly drops. The doctor says, "We will keep watching." The patient goes home afraid. And the real question is never asked clearly. What is still pushing the kidneys every single day? I am Dr. Adrian, and if you have diabetes, early kidney disease, high blood pressure, obesity, or a family member whose kidney function is declining, this video may change the way you think about kidney protection. But I need to say this first. Do not stop your medicine because of this video. Do not stop insulin. Do not stop blood pressure medication. Do not suddenly start a strict diet if you have kidney disease. And do not copy someone else's meal plan from the internet. Kidney disease is serious. Diabetes medication can become dangerous if your blood sugar drops too fast. Blood pressure medication may need adjustment if your pressure improves. And advanced kidney disease requires careful food planning. So this is not a video about reckless dieting. This is a video about asking a better question. If high blood sugar is one of the forces damaging the kidney, what happens when we reduce the foods that keep pushing blood sugar high? That question matters because many people with diabetic kidney disease are told only one thing. Your kidneys are getting worse. We will try to slow it down. And yes, slowing it down is important. But for many patients, that answer feels like standing on a train track and being told the train may arrive more slowly. What people really want to know is this. Is there anything I can do now while I still have kidney function left? Not magic, not a cure, not a miracle. A real action, a realistic plan. A medically supervised change that reduces pressure on the kidneys before more damage happens. That is where this study becomes important. A real-world group of patients with type 2 diabetes in the United Kingdom followed a lower carbohydrate approach under medical care. These were not young athletes. They were not perfect research subjects locked inside a laboratory. They were ordinary patients. Real people, real meals, real diabetes, real clinic visits. Their average age was around the early 60s. Many had lived with type 2 diabetes for years. And that detail matters, because most doctors expect kidney risk to increase with age and diabetes duration. Type 2 diabetes can damage tiny blood vessels. The kidneys are filled with tiny blood vessels, so in many patients, the usual expectation is that kidney markers slowly get worse over time. But in this group, the pattern was different. On average, important kidney markers improved. Creatinine moved in a better direction. Estimated kidney filtration improved. Urine albumin to creatinine ratio improved. Blood sugar improved. Weight improved. Blood pressure improved. Triglycerides improved. HDL cholesterol improved. Now listen carefully. This does not prove that every person can reverse kidney disease. It does not prove that advanced kidney disease can be fixed by diet. It does not mean protein should be unlimited. It does not mean medication is unnecessary. But it does show something powerful. In the right patients, especially people with type 2 diabetes and normal kidney function or mild kidney disease, reducing carbohydrate load may improve the metabolic pressure that contributes to kidney damage. That is not a small message. That is a life-changing conversation. Because many people with diabetes have been told to fear protein, but nobody told them to fear the bowl of starch that turns into sugar in their blood every morning. And this is where the confusion begins. When people hear low carbohydrate, they often imagine something extreme. They imagine eating bacon all day. They imagine no vegetables. They imagine kidney damage. They imagine a dangerous diet. But that is not what I am talking about. A responsible lower carbohydrate diet means reducing the foods that rapidly raise blood glucose. Sugar, sweet drinks, fruit juice, white bread, rice, pasta, potatoes, noodles, breakfast cereal, biscuits, cakes, sweetened yogurt, ultra-processed snacks. These foods may look normal on the plate, but in a person with type 2 diabetes, many of them behave like sugar once they enter the bloodstream. And when blood sugar stays high year after year, the kidneys pay the price. Let me explain this in a simple way. Your kidneys are not just filters. They are living organs filled with delicate blood vessels. They filter waste. They balance salt and water. They help regulate blood pressure. They help control acid balance. They help keep your internal chemistry stable. But when blood sugar stays high, the tiny vessels inside the kidneys are exposed to constant stress. The filters work under pressure. Protein may start leaking into the urine. Inflammation may increase. Blood pressure may become harder to control. And over time, the kidney function number may begin to fall. Now imagine that every day, 3 times a day, a person keeps eating foods that push glucose high. Breakfast pushes it high. Lunch pushes it high. Dinner pushes it high. Snacks push it high. The medication keeps trying to pull it down. But the food keeps pushing it up. That is like pouring water into a leaking house while someone is mopping the floor. Medication is often the mop. Food is often the water coming in. Many people need the mop. But if you never reduce the water, the floor stays wet. That is what happens in type 2 diabetes when diet is ignored. The body is fighting all day. The pancreas fights. The blood vessels fight. The kidneys fight. The doctor adds medication, then another, then another. But the incoming signal from food never changes. This is why diet is not just a side topic. For many people with type 2 diabetes, diet is the signal that decides how hard the entire body has to work. Now I want you to think about your own morning. What did breakfast look like today? Toast, rice, cereal, a sweet drink, fruit juice, biscuits, sweet coffee, a large bowl of oatmeal with sugar? Maybe you were told this was light. Maybe you were told this was low fat. Maybe you were told this was normal. But if your blood sugar rises sharply after that meal, your kidneys do not care that the meal looked normal. They only feel the glucose. This is the part many people find painful. They were trying to do the right thing. They were eating what they thought was healthy. They avoided fat. They bought low-fat products. They ate cereal because the box looked medical. They drank juice because it had vitamins. They ate bread because it was whole grain. They reduced sugar but kept eating large portions of starch. And then their diabetes still worsened. Their kidney markers still changed. Their weight still increased. And they blamed themselves. I do not want you to blame yourself. I want you to understand the mechanism. Starch becomes glucose. Bread becomes glucose. Rice becomes glucose. Potatoes become glucose. Pasta becomes glucose. Noodles become glucose. Even if the food is traditional, even if the food is low fat, even if the food is sold as healthy, your body does not respond to the marketing. Your body responds to the molecules. And if your body has type 2 diabetes, it may no longer tolerate the carbohydrate load that it once handled easily. That is not a moral failure. That is physiology. Now let me explain what may happen when the carbohydrate load is reduced safely. Blood glucose may improve. Insulin demand may fall. The body may begin using stored fat more easily. Hunger may become more stable. Weight may decrease. Blood pressure may improve. Triglycerides may fall. HDL cholesterol may improve, and when blood sugar and blood pressure improve together, the kidneys may experience less stress. This is why the study is so interesting. The kidney markers did not improve in isolation. They improved alongside several metabolic markers. That pattern matters. Because the kidneys are not separate from the rest of the body. They are connected to glucose. They are connected to blood pressure. They are connected to insulin resistance. They are connected to body weight. They are connected to inflammation. They are connected to the foods you eat every day. So when the whole metabolic picture improves, the kidneys may benefit too. Now I need to pause and protect you from a dangerous misunderstanding. Lower carbohydrate does not automatically mean high protein, and high protein is not appropriate for every kidney patient. If you have chronic kidney disease and you are not on dialysis, protein intake often needs to be individualized and not excessive. If you are on dialysis, protein needs can be different. If your potassium is high, some vegetables and fruits may need restriction. If your phosphorus is high, some foods need careful planning. If your eGFR is very low, you should not experiment alone. This is why kidney nutrition must be matched to your lab results, not to a trend, not to a YouTube comment, not to a random meal plan, to your labs. That is the difference between a dangerous diet and a medical strategy. A dangerous diet says, everyone eat the same way. A medical strategy says, what does this patient need at this kidney stage with these medications, these blood tests, and this risk? That is how I want you to think. Now, if you have type 2 diabetes and early kidney concerns, the first enemy is usually not a reasonable amount of protein. The first enemy is often refined carbohydrate and sugar, sweet drinks, large starch portions, frequent snacking, processed foods, foods that keep blood glucose high all day. That is where many people should begin, not with fear, with measurement. Because once you measure, you stop guessing. If your doctor agrees, check your glucose before a meal and 1 or 2 hours after. You may discover that a food you thought was harmless sends your blood sugar much higher than expected. That information can change everything, because now the question is not, is this food good or bad? The question is, what does this food do inside my body? That is a more powerful question. Now let us make this practical. If you want to protect your kidneys, start with liquid sugar. Remove soda. Remove sweet tea. Remove fruit juice. Remove energy drinks. Remove sweet coffee drinks. Liquid sugar enters quickly. It does not fill you properly. It can raise glucose fast, and many people drink it without counting it as food. For a person with type 2 diabetes and kidney risk, that is one of the easiest places to begin. Then look at breakfast. Breakfast is often the most damaging meal of the day for blood sugar. Not because breakfast is bad, because the foods people choose are often mostly starch and sugar. Cereal, toast, jam, juice, sweet yogurt, biscuits. Large portions of oats with sugar, Tea or coffee loaded with sugar. These foods can push glucose high before the day has even started. A better breakfast is built differently. It is built around real food, appropriate protein for your kidney stage, healthy fats from real foods, non-starchy vegetables that fit your potassium and kidney plan, less sugar, less refined starch, less processed food, more stability. For one person, that might be eggs with vegetables. For another, unsweetened yogurt with a small portion of berries. For another, fish and salad. For another, tofu with low-carbohydrate vegetables. For another, paneer or lentils in controlled portions, depending on glucose response and kidney labs. The exact food depends on the person, but the principle is simple. Stop beginning the day with a glucose surge. Now let us talk about the plate. Many people with diabetes eat a plate where the largest section is starch, rice, bread, pasta, noodles, potatoes. Then a small protein portion, then a little vegetable. For a healthy person, that may be tolerated. For a person with type 2 diabetes, that same plate may keep glucose high for hours, so the plate often needs to change. The starch becomes smaller. The non-starchy vegetables become more important. The protein becomes intentional, but not excessive. The fat comes from real foods, not processed junk. The meal becomes less about fullness from starch and more about stable blood sugar. This does not mean your culture is wrong. It means your current metabolism may need a different portion. You may not need to remove every traditional food, but you may need to stop letting starch dominate the plate. That one change can be powerful. Now I want to speak to the person who is already afraid because their kidney number is low. You may be thinking, "Doctor, is it too late for me?" I cannot answer that without your labs, but I can tell you this. It is almost never too early to reduce the pressure on your kidneys. If your kidney disease is mild, this is the moment to act. If your albumin is starting to rise, this is the moment to act. If your blood sugar is uncontrolled, this is the moment to act. If your blood pressure is high, this is the moment to act. Do not wait until the kidney function is severely reduced before taking food seriously. Early is when you have room. Mild is when prevention matters. The tragedy is that many people wait until they are frightened before they become consistent. But kidneys need consistency before the crisis. Now let us discuss the lab numbers you should know. First, eGFR. This estimates how well your kidneys are filtering. It is not perfect, but it is important. Second, urine albumin to creatinine ratio. This tells whether protein is leaking into your urine. For diabetes, this can be one of the earliest signs that kidney filters are under stress. Third, creatinine. This helps estimate kidney function. Fourth, potassium. This matters because kidney disease and some medications can make potassium too high or too low, and potassium affects the heart. Fifth, A1C. This shows average glucose over time, although in advanced kidney disease, it may be less reliable. Sixth, home glucose readings. These show what your daily meals are actually doing. Seventh, blood pressure. Not just one clinic reading. Home blood pressure matters because kidney protection depends heavily on blood pressure control. And eighth, medication list. Because when diet improves glucose or blood pressure, medication doses may need review. Now here's the part many people miss. If you reduce carbohydrates and your blood sugar improves quickly, your old medication dose may become too strong. If you take insulin, you can develop low blood sugar. If you take sulfonylureas, you can develop low blood sugar. If your blood pressure improves and you are still taking the same medication dose, you may feel dizzy or weak. You may be at higher risk of falling. So when I say food can be powerful, I mean it. A powerful change needs monitoring. That is not a reason to avoid dietary change. It is a reason to do it intelligently. Now, imagine two patients. The first patient hears about low carbohydrate eating and starts alone. No lab review, no medication review, no kidney stage discussion, no potassium check, no protein target, no follow-up. That is risky. The second patient brings the idea to their clinician. They ask about kidney stage. They ask about protein intake. They ask whether potassium needs monitoring. They ask whether diabetes medicine should be adjusted if glucose improves. They ask when to repeat labs. They ask whether a renal dietitian can help. That is responsible. Both patients changed food. Only one changed it safely. I want you to be the second patient. Now let me give you the exact words to say to your doctor. Doctor, I have type 2 diabetes and I am concerned about protecting my kidneys. I would like to discuss whether reducing refined carbohydrates could help my blood sugar, blood pressure, weight, and kidney markers. Can we do this safely with monitoring? That sentence is calm. It is respectful. It is medically serious. Then ask, what is my eGFR? What is my urine albumin to creatinine ratio? Do I have normal kidney function, mild kidney disease, moderate kidney disease, or advanced kidney disease? Is my potassium normal? How much protein is appropriate for me? Do I need potassium or phosphorus restrictions? Which diabetes medicines could cause low blood sugar if my diet improves? Should my blood pressure medicine be monitored if my pressure drops? How soon should we repeat labs after I change my diet? Can I work with a renal dietitian? These questions turn a diet idea into a medical plan. And a plan is what protects you. Now, if you are a healthcare provider watching this, I want to speak directly to you. Many of us were taught to be cautious with lower carbohydrate diets in kidney disease because we associated them with high protein. That concern is understandable. But we also need to be honest about another kidney toxin, chronic hyperglycemia. High glucose damages blood vessels. High blood pressure damages kidneys. Insulin resistance is part of a larger metabolic problem. Obesity increases kidney risk, so if a dietary pattern reduces glucose, weight, blood pressure, triglycerides, and albuminuria without worsening kidney function in early disease, it deserves careful attention, not hype, not blind acceptance, but attention. The better question is not, do I like low carb? The better clinical question is, which patient might benefit, at which kidney stage, under what monitoring, with what protein target, and with what medication adjustments? That is the level of thinking patients deserve. Now, let me bring this back to the human side. Most patients are not afraid of eGFR because they love laboratory science. They are afraid of what the number may mean. They are afraid of dialysis. They are afraid of swelling. They are afraid of weakness. They are afraid of losing independence. They are afraid of becoming a burden. They are afraid of hearing, "There is nothing more we can do." That fear is real. But fear without a plan becomes paralysis. Fear with a plan becomes action. This study does not give permission to be reckless. It gives permission to ask a better question. What pressure can we remove from the kidneys now? That is the question. Not, can I cure myself with a diet? Not, can I ignore my doctor? Not, can I eat unlimited protein? The question is, can I reduce the blood sugar burden that may be pushing my kidneys every day? That question is worth asking. Now, I want you to understand albumin in the urine. This is one of the most important kidney warnings in diabetes. Your kidneys are supposed to keep protein in the blood. When albumin begins leaking into the urine, it can mean the kidney filters are under stress. Many patients do not feel this. There may be no pain, no burning, no dramatic symptom, just a number on a urine test. But that number matters, because it can appear before major kidney decline. It is a warning light. And when a warning light appears, you do not cover it with tape. You find out what is causing it. High glucose, high blood pressure, smoking, obesity, medication issues, dietary pattern, sleep apnea, inflammation. All of these may matter. That is why kidney protection must be whole body protection. Now let us make the food strategy more concrete. The first group to reduce is obvious sugar, soda, sweet tea, juice, desserts, candy, sweet biscuits, sweet coffee drinks. The second group is refined starch, white bread, large rice portions, pasta, noodles, potatoes, crackers, breakfast cereal. The third group is ultra-processed food, packaged snacks, fast food, processed meats too often, foods with long ingredient lists, foods designed to make you keep eating, then build meals around real food, non-starchy vegetables that fit your kidney labs, appropriate protein, healthy fats from real foods, less frequent snacking, more water if your doctor has not restricted fluids, more home glucose awareness, more blood pressure monitoring. This is not glamorous, but it works with physiology. And physiology does not need to be glamorous to be powerful. Now, some people will ask, how low should carbohydrates go? The honest answer is, it depends. It depends on your diabetes control, your kidney stage, your medications, your potassium, your weight, your age, your preferences, your culture, your ability to follow the plan. Some people do well with a moderately lower carbohydrate pattern. Some need stricter carbohydrate reduction. Some need a Mediterranean-style approach with controlled starches. Some need renal dietitian guidance because potassium or phosphorus is an issue. The goal is not to join a diet religion. The goal is to improve your numbers safely. If your glucose improves, your blood pressure improves, your weight improves, and your kidney markers stabilize or improve, that is success. The label matters less than the result. Now, there is one more mistake I see often. People change diet for 2 weeks, then quit because the scale did not move fast enough. But kidney protection is not a 2-week challenge. Kidneys respond to long-term pressure, so your habits must also be long-term. Do not ask, can I do this perfectly for 14 days? Ask, can I eat this way most days for the next year? That question changes the plan. It makes it realistic. It makes it safer. It makes it more human. Because the best diet is not the most extreme diet. The best diet is the one that improves your health and that you can repeat. Now, if you live with family, this matters. A person with diabetes and kidney risk should not have to fight the whole kitchen alone. If the house is full of soda, sweets, bread, snacks, and processed food, every day becomes a battle. Family can help. Not by shaming, not by policing, not by saying, you did this to yourself. That is cruel and useless. Family can help by changing the environment. Cook meals together, walk after meals if safe, keep sweet drinks out of the house, measure blood pressure, help write questions for the doctor, go to appointments if the patient wants support. Kidney protection becomes easier when the home becomes part of the treatment. Now let us talk about what this study does not mean. It does not mean every kidney patient should eat the same way. It does not mean advanced kidney disease is reversible. It does not mean dialysis can always be avoided. It does not mean medication is bad. It does not mean carbohydrates are poison for everyone. It does not mean unlimited meat is safe. It does not mean you should ignore potassium. It does not mean you should stop your diabetes pills. It means that in type 2 diabetes, reducing the carbohydrate load may improve several risk factors that matter deeply to kidney health. That is the honest message. And honest messages save more lives than exaggerated ones. Now I want to give you a simple 7-day starting plan to discuss with your clinician. Day 1. Write down everything you drink. Circle anything sweet. Soda, juice, sweet tea, sweet coffee, energy drinks. That is your first target. Day 2. Check breakfast. Ask whether your breakfast is mostly starch and sugar. If yes, plan one lower carbohydrate replacement that fits your medical situation. Day 3. Check your largest starch portion. Rice, bread, potatoes, pasta, noodles. Reduce the portion and add non-starchy vegetables and appropriate protein. Day 4. Begin home glucose awareness if your doctor has recommended monitoring. Look at what happens after meals. Day 5. Check blood pressure at home if you have a monitor. Write it down. Day 6. Prepare your doctor questions. eGFR, urine albumin, potassium, protein target, medication adjustment, dietitian referral. Day 7. Schedule the conversation. Do not wait until the next crisis. This is not a complete treatment plan. It is a safe beginning. A way to move from fear to action. Now, let me create the picture I want you to remember. Your kidneys are like a delicate filter under pressure. Every high glucose meal increases the pressure. Every uncontrolled blood pressure reading increases the pressure. Every extra pound of visceral fat may increase metabolic pressure. Every cigarette increases vascular damage. Every missed lab delays action. But every good decision removes a little pressure. A lower sugar meal, a smaller starch portion, a walk after eating, a better blood pressure reading, a medication review, a urine albumin test, a potassium check, a follow-up appointment. None of these looks dramatic alone, but together, they can change the direction of a life. That is what kidney protection really is. Not one miracle. Many small pressures removed before the system breaks. Now, I want you to think about the future. There is one future where you wait. You keep eating the same meals. The same glucose spikes happen. The kidney number slowly changes. More medicine is added, you become more afraid, and the conversation always begins after damage has already happened. But there is another future. You ask earlier, you test earlier, you change the food signal earlier, you work with your doctor earlier. You protect the kidney function you still have. You stop thinking of diet as punishment and start seeing it as pressure relief for your kidneys. That future is not guaranteed, but it is stronger than waiting. And for many people, stronger than waiting is exactly what they need. Now, before I finish, I want to speak to the person who feels overwhelmed. You do not have to understand every kidney term today. You do not have to become perfect today. You do not have to change everything today. Start with the biggest signal: sugar drinks, refined carbohydrates, large starch portions. Start there. Then bring your doctor into the plan. Ask for your numbers. Ask what stage you are in. Ask what foods need restriction. Ask what medication needs monitoring. Ask how to repeat labs safely. You are not trying to become your own doctor. You are trying to become an informed patient. That is different, and it is powerful. Because the patient who knows their eGFR, their urine albumin, their potassium, their A1C, their blood pressure, and their food triggers is no longer passive. They are participating. That participation may protect them. Now let me give you the final message. Kidney decline in type 2 diabetes is serious. But it is not always something you simply watch from the sidelines. Your kidneys are affected by the choices that affect blood sugar, blood pressure, weight, and vascular health. Food is one of those choices, and for many people with type 2 diabetes, reducing refined carbohydrates may be one of the most important conversations they ever have about kidney protection. Not because low carb is magic, because glucose is not harmless, not because medication is bad, because medication works better when the incoming damage is reduced, not because every kidney patient is the same, because every kidney patient deserves an individualized plan. So if you have type 2 diabetes and your kidney function is declining, do not panic, but do not ignore it. Ask about your eGFR. Ask about urine albumin. Ask about potassium. Ask about protein targets. Ask about carbohydrate reduction. Ask about medication adjustment. Ask about a renal dietitian. And ask the question that should be asked much earlier than it usually is. What can we remove from my daily life that is still putting pressure on my kidneys? That question may change the direction of the conversation, and sometimes changing the conversation is the first step toward changing the outcome. I am Dr. Adrian. Do not stop your medication on your own. Do not follow an extreme diet without supervision, but do not underestimate the power of the next meal, because for many people with type 2 diabetes, kidney protection may not begin in the dialysis unit. It may begin at breakfast.